Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to the segment of Healthcare Consumerism Radio. Health and wellness is a big piece. There's been some interesting pushback at times in the marketplace on the confusion over ROI, but the health management, effective health management is going to be very important going forward as we create better consumers of health and healthcare. And joining us to talk about this today is Jed Dodd, President and CEO of Onlife Health in Nashville. Jed, good morning.
Oh, good morning. How are you?
I'm good, Jed. How are you doing?
I'm doing great. Beautiful day here in Nashville, Tennessee.
Yeah, it's going to – hopefully that's what we're about to get in Atlanta tomorrow. So it's been cold down here, but hopefully it's going to get a lot better. Jed, I know you've got Diana with you, Diana Kendrick. And she's going to talk about some of the more technical aspects. But, as CEO, give our audience a picture of Onlife Health and your position in this space.
Okay. First of all, it's Onlife Health, and thank you for your time this morning. Wellness is one of the hottest topics in the country right now because of the impact that well-conceived programs can have on individual lives and really on companies a little more broadly. And I think, no doubt, we've all seen the CDC statistics that say 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancers can be prevented by addressing three simple lifestyle changes, and those being activity levels, quitting smoking, and healthier eating. And, if you think about it, those are three simple things, but for many, the truth of the matter is it is the fight of their lives. And that's what we help our members do each and every day. Over the last 18 years, Onlife Health has been privileged to be right in the middle of that battle, and so we work with employers and we work with health plans all over the country to design integrated, comprehensive wellness solutions and a portal experience that really achieves sustained behavior change, which is the hard piece of it. Getting somebody to change their mind is easy, but sustaining it over the long haul is the trick, and also, and perhaps more importantly, improved biometric values. And that's, at the end of the day, that's what this is all about. We manage populations that are in excess of 8 million employees. And so whether you're a company that is just tipping its toe in the wellness pool, or whether you're a health plan that's been slugging it out for several years, we are very good at tailoring solutions to your existing infrastructure, setting some very strategic targets, and leading employees to lead healthier lives.
Jed, what's your target size of company? Is there a target size?
We tend to target employers that are 5,000 employees and higher, and then we also have several very important relationships with health plans all over the country.
Jed, this is Ron Bachman. Talk to the audience a little bit about your secret sauce, what makes you different. If I look at the description, you talk about combining dedicated health coach, support communities, on-site events, and the latest technologies. Give a little bit more profile and background to that. That seems to be, again, sort of your secret sauce that makes you different.
Yeah, I think the answer to that question is really finding that appropriate blend between the human interaction and what we can do on the technology front. And really, there's a lot of activity these days based in the technological realm with mobile apps and fitness devices, et cetera. And so really understanding how to work with those devices, but also at the other end of the spectrum, not forgetting that at the end of the day, human beings helping human beings is a very, very powerful component. Really understanding that blend is what we do. I've got there's an amazing case that comes to mind, and I've got a picture of a woman that is holding up a pair of pants, and she is standing with her entire body inside one of the pant legs of that pair of pants that she's holding up. And she came to us. She weighed almost 430 pounds when she started. And she had all kinds of health issues, as you can imagine, associated with lack of mobility, high cholesterol, high blood pressure. She could not walk one city block without having to sit down because she was so winded. And so we started with her, and I raise this case because I think it's important, because this is that human element that is so important in some of these cases. But she started walking 5 minutes at a time, and she eventually gained enough mobility to then get on the treadmill. And we had one little success on top of another little success on top of another little success. We had coaches working with her very frequently, setting and achieving reasonable goals, and both from an activity perspective as well as weight loss. And she visits our portal about every day, and she now weighs 188 pounds and is medication-free. And the amazing thing is her doctor told her that her resting heart rate was comparable to that of an athlete. And so I tell you that because when she started with us, she had zero confidence that she could get where she is today. And, let's not underestimate the power that one human being can have working with another when you've got that common goal. And I think back to the question of our secret sauce, in cases like that, we've got the skill and with our health coaches to make that happen, but also blending in some of the other things that are available to us on the technology front.
It's a very good story. Jed, talk about your unique partnership recently with the Government Employees Health Association on this pilot program to improve blood pressure.
Sure. Well, let me do this. Let me introduce to you Diana Kendrick, and she is one of the key contributors to our health and wellness mission. She's a registered nurse with over 30 years of experience. She's been with us for 5 years in a variety of capacities. She is currently the leader on our clinical quality team, where she is a clinical specialist for chronic conditions. And she was instrumental in making this pilot happen, where we had just phenomenal results addressing some population-wide blood pressure issues. And I'll turn it over to Diana and let her talk a little bit about what that program was all about.
Hey, Diana, welcome to the program.
Hey, thank you so much. It's nice to be here.
So give us kind of an overview on the program, if you would, please.
Yeah. Well, let me start by sort of highlighting the impact of high blood pressure. It's just a huge national health problem. 1 out of every 3 adults in the United States has high blood pressure, and another one has hypertension, pre-hypertension. That means that they're at risk for developing high blood pressure. One of the things that I find absolutely shocking is that of those that have high blood pressure, only about half of them are achieving control. So you can imagine that the potential for reducing deaths from stroke and heart disease by improving blood pressure is just tremendous. In 2012, one of our clients, the Government Employees Health Association, GEHA, requested a blood pressure management pilot. Blood pressure management is one of the HEDIS measures that the health plan reports, and they were just looking for an intervention to improve blood pressure management.
Well, the blood pressure, I think isn't that the area that many folks have labeled the silent killer?
It is.
And so that so many people don't even know they've got a blood pressure problem. And I know we've got some blood pressure.
The blood pressure is high.
Right. And we've got some mechanisms around in some of the pharmacies where you can check your blood pressure, but I'm not sure many people even know what their numbers are. As was described earlier, that you've got this high-tech, high-touch combination that really helps work your entire program. Tell us a little bit about the blood pressure program and both the high-tech and the high-touch part of your service that makes it successful.
Sure, I'd be happy to. Our initial pilot was small. We started with about 156 participants. They live all across the United States. Each one of them was assigned a health coach, and they also had full access to the secure Onlife website. And we focused on helping participants to achieve lifestyle modifications, and really the results were pretty exciting. Well over half of the participants improved their blood pressures, and in addition, there was a small but significant number of participants that maintained their blood pressure. When you look at blood pressure categories, and what I mean by that is hypertension, pre-hypertension, and healthy blood pressure, the results are equally exciting. At the end of the pilot, we had lots more people in the healthy blood pressure category and lots fewer people in the categories of hypertension and pre-hypertension. So clearly, Onlife Health was able to help people improve their blood pressure control, which is why GEHA is expanding its relationship with Onlife Health. Not only are they going to be offering health coaching on blood pressure, but also cholesterol and tobacco cessation. Mm-hmm. I know that we're getting a little bit short on time, so I just really wanted to tell you a little bit more about health coaching, which is just a passion.
Great.
I think that health coaching is the magic that drove the results in the GEHA blood pressure pilot. Mm-hmm. Not only are Onlife Health coaches able to drive results in blood pressure, but we also coach in other areas, tobacco cessation, weight management, et cetera. I would describe health coaching as a science and an art. The science part of it is providing participants with accurate, reliable health information and resources. It's sort of the what to do. The how is the art of health coaching, and that's when you're connecting the dots between what's good for a participant's health and what meets their needs. For example, the science of coaching says that a healthy diet can improve your blood pressure by so many points. But the art of health coaching consists of helping a person to overcome obstacles to adopting that healthy eating plan. Maybe they need to learn how to use food labels, or maybe they need to focus on just one food group at a time, or they may need to develop a support system to make those practical changes. So I think that health coaching is the magic.
Yeah. Diana and Jed, we are running out of time, and there's a lot to discuss here. We'll have to have you back on this program again in the near term. Jed, we got about 30 seconds to go. Do you want to leave our audience with a takeaway or two, please?
Sure, you bet. And appreciate the time today, and look forward to catching up down the road. I would just say, looking forward for Onlife Health, we really recognize the importance of a 24/7 commitment to healthy living. And, we've kind of adopted a mantra around here around the notion that wellness is always on. And that is our big deal. And what we are focusing on is bringing our coaching solutions and our technology kind of into the mobile realm and working with mobile apps, integrated devices, and those very important human beings that are upstairs making it happen every day to really step into the future and offering access to our solutions anytime, anywhere. Well, so we're excited where we're going.
Jed and Diana, I really appreciate your time on the program today, and you have a great weekend up there in Nashville, and we'll talk to you again real soon. To our audience, stay tuned for the next segment of Healthcare Consumerism Radio.